President Cyril Ramaphosa has given clear indication that he plans to go ahead with signing into law the much-contested National Health Insurance Bill. Critics and medical professionals have cast doubt on the system's ability to provide even the most fundamental healthcare services. Much of the controversy is rooted in the funding and the financial feasibility of providing quality healthcare to the entire population. However, there are suggestions that day hospitals could alleviate some of these challenges. Advanced Health Chairman Carl Grillenberger joins us now to explain why this could provide part of a solution to overburdened public health care. Carl, thank you so much for your time and for joining us this afternoon. Now, the NHS, the National Health Service in the UK, has been widely benchmarked as one of the best. What do you believe South Africa can learn from the NHS system?
Well, thank you very much. Thank you for allowing us to participate in your program. And our experience with the NHS in the UK actually dates back some 20 years. And at that time, they actually started building day hospitals on larger premises which were fitted out for academic hospitals. Now, just to give you an example, in the UK, they started with facilities that were actually mobile facilities to try to test this. But what the UK then did, they developed day hospitals with the aim to shorten their waiting lists. They had patients waiting easy for a year, more than a year for certain procedures. And they said by putting these day hospitals in place, they could actually help the community by getting these waiting lists substantially shortened. And the reason was very simple, that in a day hospital you can work quicker, faster. The productivity of surgeons is much higher than in a large acute hospital where they are waiting and where there are other complications that were delaying these surgical interventions. The other aspect that also was pointed out is the fact that actually the cost of surgery in a day hospital is substantially less than in an acute facility. In a day hospital, you haven't got various shifts of staff that they got to work 24 hours, that they got to work 7 days a week. So you're actually saving on that staffing cost. You're also saving on costs relating to a kitchen, a pharmacy, an ICU, and also you haven't got maternity or emergencies. So in short, these are compact hospitals, same standard, same quality as acute hospital theater complexes, but they can work efficiently, faster, and more cost effective. And that's why we would like to help with the NHI or the government to consider seriously building day hospitals, and that can be done in conjunction with the private enterprise. There are various private players in the industry that would be very keen to work together with the government to do this and to help to service patients that at the moment are sitting and not receiving the required services.
Now, you named quite a lot of advantages that the day hospitals could possibly have. But in the South African context, what do you believe would be some of the challenges that we could face with day hospitals?
I think the biggest challenge is actually taking decisions or taking constructive decisions, because to, for instance, build a reasonable day hospital that could help any provincial hospital or provincial facility, like we used to call them, wouldn't cost more than 100 million rand. And then it's a 3-theater facility with proper equipment, and it can attend a lot to procedures like keyhole surgery, like surgical interventions where there is a very minimal anesthetic required. And all these aspects are actually beneficial to a patient to the extent that the patient goes home the same day and recuperates at home. The other aspect that we've also got in South Africa, we've got home nursing care, which has been introduced quite strongly over the last few years, simply to make actually the accommodation of a patient at home easier, more cost effective. And if a patient has got a problem, he picks up a phone, phones a home nurse, she comes out or he comes out, helps the patient. And if there's a critical issue, the home nurse phones the doctor concerned and gets information over the phone, and you can monitor vital signs via a cell phone today. And these are the technologies that I think the Department of Health should seriously consider implementing in South Africa, because we have got all these technologies available. We are using them in the private sector, and I don't see why the state shouldn't make a point of saying, listen, we can do these things cheaper, but let's look at these things and implement some of these aspects.
I want us a little later on to touch on how the state is open to having state hospitals, but you've been involvement in rather the day hospitals, in some of them being set up in South Africa, but there's 100 day hospitals that are currently in use. How open are medical aid schemes in incentivizing doctors in ensuring that there's more activity within these day hospitals?
I think my personal view is that the medical schemes are not putting enough of an incentive into the system to really create the utilization. And that's why we've only got a little bit more than 100 day surgery units in South Africa. And we've got well over 300 to 400 acute facilities, where if you look at other countries like the United States, has got 6,000 day hospitals, or what they call ambulatory surgery centers, and they've got a substantially lesser number of acute hospitals. We can clearly see in the United States that the day hospitals are taking more and more of these surgical interventions into their system, and by that helping the system actually to curtail surgical costs.
Now, earlier on, we spoke to the chairperson of the South African Medical Association, and the association is at the moment apprehensive with regards to NHI being implemented in its form, citing that there are a lot of challenges within the healthcare system. How would day hospitals contribute to assisting government, and has government been open to having more day hospitals in alleviating some of those pressures that are cited in the healthcare sector?
What is not really known is that we as a day hospital organization, I'm here talking specific about advanced, is in fact treating government patients in our facilities. It's only to a limited extent, but we have got certain contracts with certain organizations in the government where their patients are actually treated surgical in our facilities. And from the feedback I'm getting, these state facilities are very happy with this arrangement, and they work on it. And they do patients in our facilities on a regular basis. There are, however, not the provincial hospitals or the provincial departments of health which are very pro this type of concept. It is more where we are talking and dealing with separate sections in the government, like the military or the Navy. And these are organizations that can see that they are actually saving their members and their staff costs on their surgical interventions.
All right, Mr. Grillenberger, thank you for your time this afternoon and speaking to us there about the challenges in advanced health and day hospital.